So I was standing on the median of I-78, which is a major highway. My car had just smashed into the center rail. I step out of the car, and it's nighttime. Other vehicles are zipping past me, and I'm recollecting myself. What just happened? A tractor trailer had just turned into my lane, didn't see me, and I don't really remember that much else. I then look at my car. I see the driver's window is completely smashed, and the back left window is intact. And I look at myself and notice through the window there, I see a little bit of coffee left over from the morning. And I went in, I literally stuck my body in, grabbed the cup of coffee, took 2 sips, and then returned to that one intact side window, and I performed a neuro exam on myself. I had the luxury that I did not think I lost consciousness or hit my head on anything. I thought, at least. I still think that's true. But little by little, I'm touching my nose, I'm tracking my eye movement. How good? Probably up to debate. But I kind of hit this point where I'm like, where am I? And what insurance, or what hospital would take my insurance where I'm at?
Welcome to Health Stories, real stories inside the healthcare system. This podcast is where we invite you, the listener, to listen in on real life stories of clinicians and patients. And so in these interviews, our guests are going to reflect on their experiences and share with all of us their insights and suggestions for how to navigate our complex U.S. healthcare system. I'm Nicole Defenbaugh, and today I'm joined by Dr. Dan Burke, who's sharing with us a story about when he became an emergency patient after a pretty serious car accident. So, Dan, what happened next?
So, at the time, I felt that I didn't notice anything acute happening to me. And I convinced the officer I was with, hey, I'm a doctor, I'm looking for X, Y, and Z here, and I'm a state away from where I usually work and where I live. And it would really be to my benefit if I could get within that network. And, if I notice anything, I'll stop along the way. And the officer said, yeah, that's reasonable.
So did the officer follow you back over the state lines? Is that what happened?
No. So I had some buddies by that area. We met up. He drove me to a restaurant and dropped me off, and my friend was nice enough to pick me up and drive the way.
Oh, the officer dropped you off.
Yeah, he dropped me off to the restaurant and where I met my friend, and then my friend drove me the rest of the way.
Did the officer suggest that you go to the hospital or go anywhere, or he just dropped you off?
He talked to me for a little bit, and I got the sense he was gauging himself if he thought there was anything I absolutely needed to go to. And at the time, at least I like to think, if I felt like I banged my head against something, if I felt like I lost consciousness, anything obviously acute, I would have just folded my cards and just went wherever they told me. But I felt like I had a little bit of luxury there to make that call, which, looking back, very, very stupid. And I would never tell a patient to do that. I would never tell a family member or a friend. But I told myself that.
Why do you think you told yourself that?
I wonder that at times. I have a couple reasons, I think. One, I think part of it is just my my mindset that I have to, I'm okay. I just have to keep doing things, and I'll work through whatever problem I have. And it doesn't quite play to your advantage in this sort of scenario. I definitely, I like to think I'm wellness oriented in the sense that I'm pretty strict with meditating, eating healthy, exercising. But for this sudden scenario now where I have to now put my care into other people's hands, which is ironic because everyone does that with me. I balk. So that's one observation.
So what happened next? So your friends came to get you.
So, yes, and my friend was kind enough to drive me back the rest of the way. And now looking back, my friend was like, "Yeah, you're pretty quiet the whole way back," and we made sure I was okay when I got home. Whatever, we were just chit chatting a little bit, and both decided, pretty shooken up. My car is completely totaled, and it's somewhere in another state, towed away. And so I had the next day off, thankfully. So I was just gonna sleep and see how I felt the next morning, and kind of pick up the pieces and go from there. And then with an accident, you have to call a slew of people for insurance purposes. So thankfully nothing happened while I was sleeping because I lived by myself. And which is, again, not an ideal situation on top of that. I woke up and I started feeling nauseous. I had the room was spinning a little bit, and at that point I was thinking, I just got hit by a tractor trailer. And I think, a little bit of that's to be expected. Then
So you didn't, at this point, you didn't think, maybe I should go to the doctor. Maybe I should go. I keep thinking back to when I see car accidents on the road, right? The first thing I see for any major accident or even minor accident is the EMT comes, right? So the ambulance comes. Did the ambulance ever come for this accident?
No, because neither of us reported any injuries.
Oh, interesting. Okay.
I'd been in one accident years ago, and that was a fender bender, and no one was hurt, and it was same. Okay. And in this case, the other driver was driving a massive truck, and I think the truck ended up probably okay by the looks. Yeah. Okay.
So the next morning, you're a little dizzy, a little nauseous, thinking, "This is normal, right?"
I was expecting something was bad. I wasn't in any pain, thankfully, and I somehow I haven't been this whole time. So I kind of think, if worst comes to worst, I'm gonna have a little dizziness, a little bit of nausea. That I'll take that, and we'll just keep an eye on how I feel. And I think subconsciously there's a little bit of, hey, this might not be right here, but on the surface, I'm like, yeah, we'll just see how this goes. I then sit down, start watching some TV, feeling worse, and I go, I think the screen's bothering me. So I turn it off, and I pick up a book I was reading the day before, and I can't read the words on the page. The lines are pretty blurred together, and even when I really try my damnedest and focus in, I have a hard time processing what exactly is happening. And that's when I'm like, shit, this isn't good. But even then, I take out my phone and I text one of my friends who's an ED, who works in ED, and told him my symptoms. Like, hey, what do you think? So
you sought another doctor to figure out what's going on.
Yes, via text. The best form of medicine.
Exactly.
He thinks you sounds like you might have a concussion, but I don't know what you have, because we're just texting and some words and maybe an emoji or two, and then you should probably see someone right now. So I was like, yeah, that sounds reasonable. Okay.
So you texted him your symptoms, and based on your text message, he said you should probably go to the emergency room. Okay.
Yeah. So I mean, this is something that the more I look back on, the more I'm like, what the heck am I doing? But as I kind of step away from it more and more, it's kind of clearly I also have concussion symptoms coming on pretty strongly, and that was starting to linger in my head as I was walking around my apartment, and before I went into the ED. And that's really the second reason why I think that was also when I was standing on the side of the highway and kind of going through my process and thinking I'm fine. I'm really at that point starting to get the full blast. You see football games, you see sports games, athletes get taken out. They just get plowed over by someone, and they want to go right back in. They think they're fine. It's that you think you're fine, and I thought I was. It was kind of going through this process of a concussion, which it evolves into, and what it is. It reminds me a lot of high school fashion. At the time in high school, just like when you just have the initial injury, what you're wearing, and in the case of the concussion, how you're feeling, you think that's completely appropriate for your environment. And it's only when you have time that continues afterwards, and then you look back, you're thinking, whoa, you're not okay right now. And same with fashion, like what the hell was I wearing back then? Why was that a good idea?
No.
Yeah.
So not feeling good about your choice, right?
No.
Your choice at the time. So what happened then after your ED friend tells you that you should go to the emergency room? What's he say? Or what do you do?
Well,
do you go, is this the point that you go?
I call an Uber.
Okay. So not ambulance and Uber. Okay.
Yes.
Was that his suggestion, or?
I didn't bring it up. I just.
Oh, okay.
It was like I don't live too far from I live down the road. I'll just call a guy to drive me over.
Okay.
So that was an interesting ride. Was
it because you were concerned because you couldn't see, or is it because you don't have a mode of transportation?
I have no mode of transportation at this point.
Oh, okay. If you had a car, you think you would have driven yourself over to the ED?
At that time, no. Because my big fear was I'd walk out of it and say, yeah, I really shouldn't be driving. So I'm starting to digest the seriousness of it. So I get taken by driver X to the ED. No questions asked. And I get there, and I've been in this ED many times, many odd hours of the night. It's the first time I'm actually hanging out in the waiting room for a period of time.
Wait, when you say you've been there before, you mean as a physician?
As a physician.
Oh, okay.
Yeah.
Okay.
Yes, as a physician. And
so this is your first time being a patient in the same place that you've...
Yeah, no, I haven't really been sick in a while. I've been very lucky to be young and not have anything unforeseen happen. Mm. So, and it happens to be really in the middle of flu season when this is going on. So everyone else is really sick around me, and everyone else has a lot of comorbidities. I kind of walk in and think, just say I'm a resident. Maybe they'll just kind of push me in real quick and get me out. Not the case at all. Being a young male with no medical history does not have the same sex appeal as everyone else who has has heart disease, COPD, poor kidney function.
So you were moved down the list.
yeah, I can't gripe about that at all. I would have done the same thing in their shoes. And I think that starts to kind of uncover my whole error with this stage of this initial stage of my concussion is the whole time I'm a patient and I'm thinking about it as a physician. And, I'm waiting, and I think this whole time I'm sitting there thinking, they're going to probably do a CAT scan, see if I'm doing a brain bleed. They might check my carotid artery because I was wearing a seatbelt, as everyone should. See them just throwing public service announcements as I'm talking.
Wear your seatbelt. Excellent. Okay.
I'm really here because I'm concerned I have a concussion, and I would really like a referral to see if I can get further testing. And, I'm there for 10 hours in total because it's very, very backed up.
So you're a doctor and you were in the ED, and you told them you were a physician and you were in the ED for 10 hours.
Yeah.
Okay.
Yeah, that's usually not the case where it's that it just happened to be really at the peak of a really bad flu season.
Where would concussion be in terms of seriousness, though?
So it depends on the situation. If I had come in from an ambulance the night before, there's a good chance I would have been seen pretty quickly because you would look for something acute. And I came in the day after. So time had allowed for those X, Y, and Z scenarios that I was testing myself for on the side of a highway to try and rule out, which really, what I was doing really wasn't doing that much justice. And even, it's like when you're doing a neuro exam, you're touching your face, you're testing your strength. You can't really do that on your own. And I mentioned at the beginning, touching my nose, you don't actually touch your nose. But I probably was at the time because I probably didn't have good coordination. And yeah, I waited in the waiting room for 5 hours. Didn't appreciate how it's really, when you're photosensitive, it's a really bright room. And I'm just kind of tucked away in a corner, have my hands over my eyes, and I'm just waiting, being patient. But I can't look at a screen. It hurts my head. I can't do anything. I just have to sit there. And it was sort of my definition of hell, because I like to do things. I like to be on the move. And it's probably, as a product, how I'm hardwired as well at this stage. So when someone's, hey, you have to sit down, and then you can't do anything. You can try to, but you're only going to feel worse, and you're just not going to do anything that much longer. So I do nothing for 10 hours, and everyone was very nice to me, and everyone was very sympathetic, and I got a CAT scan, checked my carotid artery, nothing was seen there, and concerns, sign of a concussion. And at that point, they give me a referral to the concussion clinic. And, at that point, it kind of starts to become clear that I need to follow up with them. And I do pretty quickly because I'm feeling worse. And at this point, they start to allow me right in, because I'm now starting to move away from emergent scenarios into scenarios where you schedule appointments. And at that time, you have the flexibility to allow someone who's working to go in. Not that should always be the case at all. And I at least I want people who are sicker than me to get care of first than me.
Oh, okay. Yeah. So one of the things I want to go back to is that you chose to go to the ED instead of going to a PCP, for example, a primary care physician, right? Yeah. Do you have a primary care physician?
Now I do.
Oh, okay. But you didn't at the time?
No,
okay.
I didn't. I had a doctor who I used to see a couple years ago at this point, but I didn't live around here then. And I just thought, I'll get there, and I never got there.
Well, I hear that's fairly common, though, among physicians, the not having a PCP. It was in a Wall Street Journal article from 2010 I recently came across. It said that physicians don't have their own PCP and they don't usually take care of themselves the way that they take care of other people. Would you say that's true for you?
Yes. Yeah, and I think one of the more enlightening parts of this process is now, as days are starting to go by, I'm accepting that I need to be a patient in this scenario, and there is a huge gap between being a physician and a patient, and I did not expect such difficulty that it would take to really make that leap.
So what was difficult about being a patient, making that leap?
So there's several layers to it. You're at this point, you're not the person calling the shots. I'm more at this point wired, when I'm getting a list of symptoms from someone, including myself, and I have a clinical suspicion. Just as importantly, I have robust resources to refer to make something accurate. And now I'm in a scenario where I don't have the wherewithal to utilize any of that. And you don't with a concussion. And this ended up lingering for a good month.
So you mean, when you say all of that, you're talking about medical information and journals, and that's
yes.
What you're saying. So you have access to all of that information, but it really doesn't mean anything because now you're the patient and you're not the physician.
Yes, I happen to have a condition that literally strips the physician part of me out at this time, and I, at first forcefully, but really more actively as I went on to be a patient. And, another part with being a patient is you have to allow trust with many people. And I myself is a pretty, I like to see good in people. I do, and I'm feeling pretty positive person, and you're more optimistic than most even. But for some reason, now that I'm at a state where I have to really have other people be the guiding hand, it was a lot more difficult than I thought. I'm at this point, I was trained to communicate well and with my peers and get feedback, and at that point I thought that's a useful tool in many scenarios. It is in some. It is when you're a physician and you're slowly trying. You're always evolving, and the more you listen to people, the more attuned you are to your flaws. The more attuned you are to just things about yourself you weren't even aware of. Mm-hmm. And that's a lifelong process. But when you're a patient, there's more vulnerability with that.
I can't help but wonder as I'm sitting here talking to a physician who became a patient in the ED, and you're talking about issues of trust and how challenging it was for you to sit there for 10 hours, right? Not being able to do anything except just sit there, and needing other people in order to be better. And how many of us, are patients on a regular basis, and how many people who are listening who are patients, and what has that done for you as a physician now when you go back into the ED? So I guess the question is, have you been a physician in the ED since this has happened?
Many times.
Yeah. And so what's that like for you now, having been a patient, having been in that situation where you had to wait 10 hours? And I don't think that that's uncommon for many people to wait 3, 4, 5, 10, 12 hours in the ED. And putting your health in other people's hands, and what that is like for you, and thinking about that as a physician. How does that affect the way that you treat patients now? Has it had any change for you?
It's had a huge impact because it's added another layer to what I hope to be is my evolving empathy as I grow with each year as a physician. And you have a patient that comes in and they have a number of chronic conditions, and that's a lifelong battle. And prior to the injury, my empathy rooted more in really appreciating where they're coming from, with the acknowledgement that I can't possibly feel what it's like having chronic kidney disease or CAD, but I can certainly put myself in the shoes of the emotions attached to it, the day in and day out struggle. But what I've now added to that layer is the wherewithal that patients have to put themselves out there every day, and it is in many ways its own job. I mean, to be a patient, to be one that you're constantly seeing physicians and you're trying your damnedest to take care of yourself, it's draining. It takes a lot of work, and that lot of waiting, a lot of conversations you don't necessarily want to have. After the sixth person I was talking about with my concussion, I was fucking done with talking about it. It's just I'm tired. I want to sleep, and these people have to do that every day. So there's this mindfulness component to that. Now there's also other patients too who thrive off that. There's also patients who like the extra attention, and sometimes that's good. Everyone needs a little TLC, but sometimes that can cause harm as well. There's some patients that will. I don't feel this way, but I could appreciate some patients who this is their life at this point, and having these illnesses is it's part social to some extent, because this is so much your life. The people at the offices you go to, they're the ones who you see every day.
So it sounds like you're getting into like individuals with chronic conditions, and when you see them and they frequent the healthcare system. In your situation, this was you in the ED for one very long stretch of time, right? And when you have patients that come in, so I'm thinking about how you said, it's hard for you to see, you're nauseous. What do you do? So I hear you're more empathic. I hear that you're more mindful. Are there other things that you do as a physician, and the advice that you would offer others for what they might do differently and how they might demonstrate that and actually show that, or questions they might ask, things they might do differently?
I think the biggest thing for me that can be applicable, I do not judge anyone, because I think back to when I was in the ED as a patient, and I'm probably either the healthiest or one of the healthiest ones there, and I have all this baggage with me just from the last few days, all these emotions that come in, and this doesn't even start to skim the surface. It's just you just had a traumatic accident. There's acute stress that is a natural process. And we have everyone else in there who was going through many different phases of that all the time. And I just, no matter how so a patient talks to me or treats me, I don't judge. If someone becomes angry at me for something, if someone's very sweet to me, I do not judge. I use it as a tool to help me get a better sense of where they are right now. I just there's so many people that I came in just in that one lone visit, let alone the slew of visits I had afterwards. And I don't know how I interacted with them. I was not completely there. And
when you were a patient.
When I was a patient. And there's nothing anyone could have really done at that point, minus minus a very serious diagnosis or something of that level. That was really going to have an effect on how I am, how I talk to people. So when people communicate with me, if someone raises their voice to me, if someone gets very emotional, I don't take it personally.
And I bet that can be hard if someone's yelling and you can understand potentially why they're upset or angry or so in addition to being empathic and mindful, it's this idea of not judging and not knowing their whole story and being open to what possibilities exist or why they're upset in the first place.
If life is a video, when we see them, we're literally just looking at a picture. We don't. There is not enough time, and you can be the best historian. You are just scratching the surface of their life. You really do not know the patient, and it is not your job to judge them for that moment.
As a patient, what are some insights that you have about having been inside the healthcare system from the other side? What would you do differently, or what would you do the same if you were in that encounter or situation again?
Well, first thing that jumps out, to all the kids at home listening, if a tractor trailer plows into you out of nowhere, you should go have someone see you like right away. Don't wait. It's not.
Don't wait. Right?
Yeah. You're not Superman here. Don't do that. But a big thing I've learned, because so the last time I really had some significant level of care where I had to see more than one doctor, it was probably when I broke a bone a long time. And even that's not the same significance of this, because I felt like I saw everyone and their aunt after the end of that month. You have to put trust in the communication between physicians, because there is that constant communication, and it's scary, because when kind of was talking to you, you're making yourself vulnerable, and I'm saying it when I'm imagining myself talking to one person just like I'm talking to you, and then now suddenly it's okay, well, now you get to tell this other guy who's very specialized in talking about your vulnerabilities and that particular aspect of it. And so now you're doing it again for just this one sliver to someone, and then you got to do it to someone else.
Is that why you were frustrated by the sixth person who was asking you?
Yeah, because I was tired of talking about it, and it's also kind of underlying the fact that I didn't feel like, I felt like I was fine. It was weird. I felt like I was fine, but I felt like crap at the same time. But that's how a concussion works. It's disorientation. That is the biggest thing.
One of the not to go back really quickly, but I can't help but think, and I've had so many people ask me this question, and I can hear people wanting to know too, why do 6 people ask the same question? Why do you get 6 people who come into the room and ask you the same question over and over again? Do they not talk to each other?
That's a great question.
I know people are dying to know.
So
what would you recommend? What do you do? What did you do as a patient? So you got upset, right?
I got upset, and I know why we do it. So you do learn something every time you part of the care team asks a story. If you have a book you really love and you read it over and over, you learn new things about the book each time. Oh, there's this little detail I didn't notice. And that's very important when you're trying to get as much of a snapshot of a photo of someone's life who's really a full-length movie. And you take every little detail that you can. And if it takes, there's been times several people ask a history before I came in. When you're the frustrated patient like I was, you don't realize it, but when you're saying something a 5th time, there's a decent chance you're going to add a detail that you didn't even think about, and you spoke all the main ones so much that something else came to the surface, and that little detail can really change the course of treatment. I swear it's not done to be mean. It's
to trick somebody into saying something different.
Yeah, we're not not just like behind a glass window, or so. Let's get someone else to ask them. Yeah, it's it really paints the most detailed picture we could get.
So go to the hospital when you have an accident. That's what you learned from this story, right? Don't wait until the next day for your ED friend to text you that you should go to the hospital.
That's the learning point that I got out of it. But the bigger thing though is there is constant communication going on. It's hard to fully grasp that as a patient, just how much we're keeping an eye on you, we're talking about you, even though we're not in the room. And it seems whenever we're in the room, we're asking the same questions. There's a lot more dialogue going on.
Behind the scenes, right?
Behind the scenes, all behind the scenes.
Know. Okay.
Yeah.
So keep communicating, let people know what's going on. They're going to keep asking the same questions, and put your faith and trust in others. Yeah. It's hard.
Yeah. Yeah, and then also another reason why we ask the same questions is things might change from when the first person asks to the 6th person, not necessarily your story. Although sometimes that does happen. That's not why we do it. But your body might be changing. And especially somewhere in the emergency room setting, when you have a lot of acute things happening, a lot of unhealthy people coming in, and sick people. And something with your heart can happen very differently from the first person who asked you the questions 2 hours ago versus now. And that can be life or death.
Well, thank you, Dr. Burke, for joining us today on Health Stories. Cannot thank you enough for being here and sharing the story about when you became an emergency patient and how it's really impacted you, and the insights that you've offered all of us, both as patients and physicians and all of us who navigate this healthcare system. So thank you again for joining us. This is Nicole Defenbaugh with Health Stories.